Hello, this is Dr. Charles Foster, and today I'm bringing to you a well-momentum moment. Today I want to show you how to use the neck orthotic to help improve the curve of your spine. One of the things that we do in our office is we help people improve their posture. Improved posture means more strength, more flexibility, more range of motion. Also, your spine degenerates slower. So what we want to do is we want to help you get your spine into the correct position. So I'm going to show you how to use this. This is one form of a neck orthotic. There's many different forms. But on this one, I'm going to just show you how to use it. We're going to lay this down here, and the big wide part, flat part, goes on the table or on your floor. This probably is not to be done in your bed, more likely on the floor, or if you're lucky enough to have a massage table at home, you can use that. But so it lays down a big flat part like this. I'm going to bring over my my patient here. This is Dr. Taryn Mason. And I'm just going to show you how this looks. So if she was laying down on her back, we're going to put this edge right here, right at the base of her skull, or where her hairline meets her neck. We're going to start right there. And we're going to rest with it like this for 2 to 3 minutes. I like to tell our patients about the length of a pop song on the radio. And then we're going to move it down into the middle part of her neck, right in here. And then the third place we're going to put it is right here. So we're going to just go through this. It's going to be 2 to 3 minutes here, 2 to 3 minutes here, and 2 to 3 minutes here. And over time, what's going to happen is it's going to help you extend your neck further back. It's going to help your discs imbibe more fluid. And it's going to help us to make the correction we want to make. So I'm going to lay this down here. I'm going to have Dr. Mason lay back. And I'm going to place this right at, she would do this on her own. So she's going to put it right there. And this is kind of a good judge. When you have it in the right place, if you were to take your fist, you can put your fist in your chin. There's almost no space between your chin and your sternum, okay? And so she's going to rest there for 2 to 3 minutes. You can also use this like a foam roller after exercise. So if you were to have a sore spot on your neck, you could roll your head back and forth and sort of massage that sore spot. And I want you to breathe deeply and keep thinking about relaxing. The more you relax, the more the muscles will lengthen, and we'll begin to see a little increase in this gap here, okay? So we're going to jump ahead as if she's been here 2 to 3 minutes, and I'm going to have her move it forward, and it's going to be in this sort of bare part of our neck. We were at the hairline, now we're here, we're not down to the collar yet. So now look, there's a bigger space between her sternum and her chin. Her chin is a little bit higher, the crown of her head is a little bit closer to the table. And she's going to do this for 2 to 3 minutes. And of course, if she finds some little tender spots, she can give herself a little massage there. That little motion is helpful because it helps to open up the disc and increase motion, and you can get rid of some of those little tight little trigger points that are in the neck. We're going to jump ahead again as if she's been there 2 to 3 minutes, and she's going to put it right on what we call in chiropractic the vertebral prominence. It's that little bump at the back of your neck. It's right where our collar is, right in here. So now you can see that her head is nearly touching the table, and there's a big gap. I can almost put 2 fists in here now. Her neck is an extension. So if we could see, if we had x-ray vision, we'd see her neck is curving over this arc like this. So we're going to have her there for 2 to 3 minutes, and then when she's done, we're going to have her gently pull that out from behind her neck, and we're going to have her tighten her core, and we're going to have her sit up. Don't strain your neck like this. And there you have it. So that's how you use your cervical orthotic. There's several different versions. This is the one we presently use in our office, and we like it a lot. We're getting very good results. If you wonder about your posture, you could also give us a call, and we'd be happy to talk to you about that. Very good. This has been your well-momentum moment.